Hello, this is RGerard, and the purpose of this presentation is to provide a review and analysis of the First Aid application. The First Aid app is sponsored by the American Red Cross, whose mission is to help people prepare for and respond to emergencies. This application's intended use is to be an excellent reference tool to be used in emergency situations. The user will have access to CPR and first aid techniques. This includes access to educational courses, instructional videos, quizzes, and more. The hospital locator and call 911 features are added features on most screens. The app provides users access to educational courses and skills that can save lives. First Aid is available for free through the Apple's App Store and Google Play. This presentation discusses the free Apple version. The First Aid application benefits anyone needing to provide first aid, whether they be a medical professional or a bystander. Users need this app so they are prepared to administer emergent and non-emergent first aid from any location. The app provides users with up-to-date information on how to respond to emergencies, such as cardiac arrest or anaphylaxis. The Hospital Finder feature uses the device's location to find the closest hospitals in the area, which is a time-saving technique when needing to transport someone to the hospital. In addition, when not using the app, in an emergency, the user has the option to click on the training icon at the bottom of the screen to learn about life-saving techniques. This screen shows an example if you are a nurse working in a hospital and have never seen a stroke patient, but suspect your patient is having a stroke. This app will guide you to assess signs and symptoms and how to care for the patient until the rapid response arrives. The image on the left is part of the first aid list from the home screen. The nurse will select stroke, and the emergency steps and general care steps follow. As far as using this application, this presenter found it to be user-friendly with a simple, straightforward layout. The print was large and in simple font, which made it easy to read. Also, the emergency categories are clearly defined, so it was easy to navigate through the app. Let's take a snake bite, for example. Figure 1 shows the app's home screen. We will select Bites and Stings. Figure 2 lists a more specific category. We will then select Venomous Snake Bites. The emergency steps shown on figures 3 and 4 are specific and easy to understand. Figures 5 through 7 list the giving care instructions to provide accurate and up-to-date first aid and omit medical jargon, avoiding confusing terminology. There are several helpful features embedded in the app, such as a video component to help with instructions such as proper hand placement for CPR, or an audible metronome to be used as a guide with chest compressions. In the app, there is no data entry option, which means no mistyping, which decreases chances errors will be made. This app can be used in English or in Spanish. The benefits of the first aid application outweigh the limitations. The app is easy to use, provides quick access to up-to-date emergency information that a nurse or a bystander can use to save a life. The additional benefits for a healthcare provider include easy access to certification classes and recertification reminders. The limitations include taking a bit too long to get back to the home screen. It lacks an audio component that would be helpful so that the app could read the directions to the user instead of them reading the directions. And it is only available in English and in Spanish. Overall, this presenter would recommend the First Aid app to anyone, as the information it provides is invaluable. The American Red Cross created the First Aid app to be used as a medical reference tool for emergency situations. It uses safe patient emergency guidelines, and the care recommended is enhanced and streamlined for use by nurses and anyone needing to provide first aid. The app is easy to use and provides useful and educational information to its users to help save lives.